Gurmagat Cahirlach, and can I start by echoing the sentiments of my colleague Minister Butler in her opening remarks to deputies, to colleagues here, but I think in particular to the deputies who tabled what is a very constructive motion and for the very positive contributions to this important debate today in regards to targeted investment in our health service. Our health service, as colleagues will be aware, has been through extraordinary challenges. A global pandemic, a cyber attack, a recent winter season like no other, with a combination of flu, COVID and RSV, all combining to put our health service, our patients and our health service professionals under very extreme pressure. Pressure that we know is compounded by a population that is growing and that is ageing and therefore has more and more care needs that we have to meet. It's crucially important to acknowledge the outstanding efforts of our frontline workers right across the country, right across our health services. The government has been working to match their commitment by investing more than ever before to expand and reform healthcare in Ireland. Minister Butler has outlined in detail the scale of that investment. We have put in place an additional nearly €5 billion in core funding since 2020. We've overseen the largest expansion of healthcare staff since the establishment of the HSE. In fact, since 2020, we've hired more than 20,000 additional people into the health service, over 6,200 nurses and midwives, over 3,000 more health and social care professionals, nearly 2,000 more doctors and dentists. There has never been as much recruitment into our public health services. But we all know, and the debate today speaks to this, it's not just about investment. Yes, we are expanding services, we're expanding capacity at a level that hasn't been seen before. But reform, meaningful reform, is also vital for patients and to the future of our health and social care services. Our goal is universal healthcare, a healthcare service that gives everybody the care they need when they need it. And we are making progress. I fully acknowledge the challenges. Challenges in emergency departments, challenges accessing GPs, challenges for too many patients on waiting lists. I fully acknowledge it. But we must also acknowledge that important progress is being made. Last year, the number of people waiting over the agreed targets of 10 and 12 weeks fell by 11%. That's 56,000 less men, women and children were waiting longer than the agreed targets just last year. Since the peak of the pandemic to the end of last month, there's been a reduction in those figures of 21%. That's 135,000 less men, women and children waiting longer than the Sláinte Care targets. Is it enough? No. There should be nobody waiting. But let's acknowledge that our healthcare providers, our healthcare professionals, they're doing the business. 135,000 less men, women and children. That matters. It matters. The motion calls for measures to tackle overcrowding in our hospitals, quite rightly. We know it's a problem. We've seen the numbers. I've been in many of the emergency departments. I've spoken with patients. I've spoken with our frontline staff. The current situation in too many of our emergency departments on too many days of the week is simply not acceptable. We must and we are rethinking how our emergency departments work, how they're provisioned to tackle the issue of overcrowding, of people waiting for too long, patients waiting on trolleys for too long. We're looking at discharge rates over the weekend, at the availability of healthcare workers, at provision of community teams to support the transition of patients out of the hospitals. I've asked the HSE to develop an urgent care plan for this year, drawing on the lessons learned from winter and what is known in terms of what works, and I'm expecting a final draft of that plan later this month. I've also asked, however, for a 3-year plan, because we've got to tackle these problems not just in the short term, we've got to put in place structural solutions to this. The independent deputies who tabled this motion quite rightly point to medical assessment units and local injury units. The urgent care plan is looking at these and is looking at expanding provision across these. Personally, one of the things I think we need to do in the injury units is standardise them. It doesn't work for people to have to figure out, well, what does my injury unit do? Does it do paediatrics? Is it open at 7 o'clock? Is it open on Saturday? It should just be standard, like the emergency departments are, right across the country. And yes, there is more we need to do in injury units. Yes, there's more we need to do in the medical assessment units. But we also know that the solutions to overcrowding, most of the solutions, are found outside of the emergency department, either providing people with care so they don't need to go to the emergency department, or getting them out of the hospital to appropriate community or home-based care as quickly as possible. I'm focused on an unprecedented expansion of primary and community care to this exact point. Enhanced community care has seen the establishment of 94 community healthcare networks. So 94 of the 96 teams are now in place. Each of these is serving a set population. In every one of our constituencies now, there are these new community healthcare teams that simply weren't there 3 years ago. We're putting in new specialist teams for elderly people, for chronic disease management, and over 2,500 staff have now been recruited, and I have funded 3,500 staff. They're bedding in. The feedback is very good, and this is brand new. These services didn't exist 2 years ago. They're bedding in, they're linking into the hospitals, they're linking into the GPs, and the feedback we're getting is very positive. There's more that needs to be done. There's further integration. The teams, we've still got about 900 people we have to hire into the teams, but the feedback is very good. We're developing services for our ageing population through the provision of the integrated care teams for older people. We're looking at the impact of chronic conditions through community-based chronic disease management teams. The GPs are working with this, and again, the feedback I'm getting from patients is very, very strong. So people who have diabetes, people who have heart issues, people who have respiratory issues, rather than being referred by their GP to go into a consultant in a hospital, their GP or the specialist team in the community is now managing them. They're not having to go near the hospitals. It's making a big, big difference. The GP Access to Diagnostics programme, which we launched 2 years ago, is giving GPs and their patients direct access to diagnostics, which they've been asking for many years, which they haven't had. Last year, there were over 250,000 scans of different modalities through this programme. This year, again, they're well ahead of target. We're at about 115,000 scans so far. And preliminary research from the ICGP suggests that maybe 9 in every 10 of these patients, the GP otherwise would have had no choice but to refer them in to an outpatient appointment or into an emergency department. I'm also strongly committed to pursuing the e-health agenda in terms of capital, revenue and resources. We all know that Ireland is a laggard on e-health. The situation is completely unacceptable in many of our hospitals, in many of our community services. My department and the HSE are working together to put in place a new digital strategy and a plan to implement that strategy so we can get to digital health and we can get the electronic health records that are needed. And deputies will be aware we have a health information bill which is going to provide the legislative framework for all of that as well. I want to thank deputies for their contributions, and I want to again acknowledge the independent deputies who tabled this motion. I think it is genuinely a very constructive, very positive motion in terms of recognising the problems and calling for the right solutions. I'm absolutely determined that we're going to continue to increase capacity right across our health system in many ways, in some broad ways, and then, as the deputies have called for, in some very targeted ways as well. But can I say this? Expansion of capacity is absolutely essential, but it is only half of the solution. The other half of the solution is fundamental reform in how our health services work. And I agree with a lot of the points that have been raised. I agree with the points in terms of productivity. Are we running our hospitals with the information that we need? No, we're not. Do our health care managers, do our hospital managers, do the HSE centrally, do I as Minister, do we as the Oireachtas, do we have access to the kind of productivity data that we need to hold the HSE to account, to make sure that everyone is doing the job they're meant to be doing? No, we don't have that information, so we're putting it in place. We're fundamentally reshaping where patients are cared for. So more and more care, as deputies will be aware, is being delivered in the community. We're supporting our healthcare workers to work to the greatest extent of their training and of their practice. That's through new GP programmes like chronic disease management, through advanced practice, be it nurses, midwives, health and social care professionals, enhanced role for pharmacies. We're working there as well. Critically, we are extending the normal working times for our health service into the evenings and at the weekends. We're organising, or we're reorganising, the health services into regional areas to deliver properly integrated care. It is only through this combination of very significant investment and expansion in capacity, coupled with fundamental and meaningful reform to how patients are cared for, that we will achieve our goal of universal healthcare.
Thank you very much. Now, Deputy